Hello and good afternoon or evening or morning, wherever you are. My name is Dean Thomas LaVeist, and I'm honored to serve as Dean of the School of Public Health and Tropical Medicine at Tulane University. We have a webinar for you tonight to talk about some changes that we're making at the school. And let me just ask Nick if we could start screen share. We're very happy to be able to announce some changes that we're making at the school that I think the alums would be interested in knowing about, and we're certainly interested in getting your feedback and thoughts on the changes that we're making. Could you go to the next slide, please? So in 2018, when I arrived at Tulane as dean, we began a strategic planning process that has guided our course over the last 3 years. What we concluded during that strategic planning process is that there were 5 strategic directions that we wanted to pursue over the next 5 years. We're now beginning year 3 of this 5-year strategic plan. And we've made many changes that I'm sure you've heard about a number of those changes. But one change that I think is going to be really important to many alums is a change that I think relates to at least 4, if not all 5 of these strategic directions for our school. And that is a change in the realignment of our academic departments. You know, many of you are, and like me, are graduates of an academic department that no longer exists. My home department back at my School of Public Health, where I attended at the University of Michigan, my department no longer exists. And so I was forced to become an adopted alumnus of one of the other departments, which is the way that we do it. But we're making a change that I think would be pleasing to many of you who graduated before 2010. Next slide. We're announcing tonight that we have eliminated the Department of Global Community Health and Behavioral Sciences and developed 2 separate departments that, I think will be a structure that is better aligned with the strategic direction of the school. And that is, we've established the Department of Social, Behavioral, and Population Sciences and the Department of International Health and Sustainable Development. I have the chair of each department here this evening, and they'll talk a bit about the strategic direction of these 2 new departments. And then we'll be happy to answer any questions that you have about the direction that we're going and the reasoning behind our decisions and what we're planning for the future. So I'd like first to, the chair of the Department of International Health and Sustainable Development is Dr. David Hotchkiss, who has been a longtime faculty member at the school. And many of you, I'm sure, would be familiar with David. And he'll be speaking about the Department of International Health and Sustainable Development. But first we'll have Dr. Gretchen Clum, who is serving as interim chair of the Department of Social, Behavioral, and Population Sciences. So I'll turn it over now to Gretchen and have her talk about plans for this new department.
Thank you, Dean LaVeist. Welcome. I'm excited to talk to you about the Department of Social, Behavioral, and Population Sciences and some of the programs and opportunities that we have in our department. So the mission of our new program is to prepare future generations of highly skilled and socially conscious, culturally sensitive public health professionals for careers in research, program development, evaluation, and community-based health, with the goal of advancing health equity. Our department is a broad mix of public health social scientists working in New Orleans and around the world. And our focus is to address the behavioral, social, and structural bases of health inequities and develop health interventions across the social ecological model. We are 25 plus full-time faculty members with 4 departmental staff. We have 150 plus MPH students and 45 doctoral students, 2 research centers, 2 training programs, and 1 institute. Our master's programs are numerous. We are launching this fall the new Social Behavior and Population Sciences program, which will focus on social and behavioral methods, health equity, and the social determinants of health. We also have our other programs ongoing: nutrition, maternal and child health, health education and communication, and community health. We also have a dual degree program in the Master of Social Work and Master of Public Health, as well as the MD MPH dual degree program. We have a doctoral program, a PhD program, as well as a DRPH program, and a non-degree program that we also have is the Tulane Dietetic Internship. These are just our directors of our various programs with contact information, should you be interested in getting in touch and finding out more details about the various programs. Our DRPH program is currently undergoing a reorganization, and we will be actively recruiting for the new program in fall 2022. But this is definitely an applied Doctor of Public Health program and leadership focused program that we currently have students in as well, but is being reorganized and refocused. We also have a PhD program in social behavioral and population sciences to train experts who advance the field of social behavioral and population sciences through research, development and application of theory and teaching. We are helping graduates to develop expertise necessary for a research career in universities as faculty members or in research organizations globally. I'm going to talk briefly about some of our centers, institutes, and training programs that are available for our students in our department. Next slide. The Tulane Center of Excellence in Maternal and Child Health Education, Science, and Practice, which we call KEMCH, is a training program to expand and strengthen the MCH workforce for the purpose of improving the health status of women, infants, and children, youth, and families in Louisiana and the US. The training program includes seminars and workshops for students, helping them develop long-term leadership goals, and supporting students for regional and national conferences, developing partnerships with public health agencies, and research collaboration. It also has specialized coursework, mentoring, and applied practicum experiences associated with the program. The Tulane Nutrition Leadership Training Program is a Master of Public Health with enhanced practical training. It's focused on a food systems approach to maternal and child nutrition and includes coursework across a variety of our courses in SBPS with a nutrition and MCH focus, and also applied training experiences for our students. Next slide. We also have the Mary Amelia Center for Women's Health Equity Research, called MAC. This center is focused on outreach and advocacy and interdisciplinary research to remove barriers to better health for women, children, and their families. We work actively with the community at MAC to remove barriers in the workplace, neighborhoods, and social networks. We also have the Violence Prevention Institute. The goal of this is to understand the causes of violence and inform prevention efforts. We are bringing together faculty across the school and community to focus on Tulane's violence prevention efforts and grow research and dissemination of our work in this area, and to facilitate collaborations across all Tulane networks and community partners focused on violence prevention. Our department also has courses offered abroad at the Taiwanese Community Health Strategies and Food Security and Resilience in Italy, and also offers the opportunity to go abroad, study internationally in Cuba and mainland China in other departments. In terms of our MPH graduates, we have a large portion of our graduates employed in healthcare, higher education, and nonprofit and government types of jobs. And the research in our department is exploring how individual, social, and environmental determinants of health are implicated in public health problems of our day, such as drug use, risky sexual behavior, under and overnutrition, mortality in maternal and child health, and violence. We focus on promoting healthier behavior, environments, and universal coverage of services, and how to plan and monitor and evaluate programs that are in the service of those goals. And we work actively to engage with the community and serve the community we work with to promote health equity. A couple of examples of ongoing research in our department include identification of state-level policies influencing the incidence of maternal and infant mortality, conducting the first community-level randomized controlled trial of blight remediation to examine its impact on youth and family violence, developing a mobile app-based intervention incorporating daily mood and geographical influences to improve mental health and adherence in HIV-positive persons with histories of violence, and exploring neighborhood and retail food environments' effect on food choices and health outcomes. And that concludes my overview of the SBPS department. I'm going to introduce Dr. David Hotchkiss, who is Professor and Chair of International Health and Sustainable Development.
Thanks, Gretchen, and welcome everybody. I really appreciate the opportunity to describe the new Department of International Health and Sustainable Development. And as Dean LaVeist mentioned, I've been here since 1994, and I've always been part of this group of international health faculty. So next slide. First, why the change? Why have a separate Department of International Health? Well, for those of you who are not familiar with Tulane's International Health Program, Tulane has an invaluable legacy in international health and development that has been really the envy of many other programs of global health around the country, around the world. The IHSD program began in the 1970s as an interdisciplinary program administered by the Dean's Office. And in 1993, the department was formally established and first admitted students into its MPH program and also its doctoral program. And until it was merged into another department in 2011, we had it was an extremely strong and productive department led by department chairs, Bill Bertrand, Jane Bertrand, others. We had one of the largest MPH programs in the school. We had a very financially robust portfolio of sponsored research funding. In 2011, a decision was made to merge the department with the Department of Health Systems Management, and that was part of a school restructuring initiative. So the IHD program was disbanded. Eventually, the IHD MPH program was reestablished within the Health Systems, Global Health Systems Management Department. It then shifted over to another department, as did many faculty. But just the restructuring that occurred during the last decade was really led to a lot of challenges in marketing the IHD program to prospective MPH as well as doctoral students. When Dean LaVeist arrived at the school, there really became an opportunity to reestablish the International Health Department as the new strategic plan called for restructuring the GCHB department and also identifying a new structure for global health. The IHD faculty really welcomed this opportunity because we were of the view that we had a very strong legacy in international health and development, but that if we didn't capitalize on that, we ran the risk of losing it permanently without having some kind of a separate department or some kind of an initiative to highlight international health and development. And that's a brief overview of the background, but it really gets at some of the main arguments for establishing a new department. It would enhance the school's already strong brand in international health and development that could help the school market its IHD programs to prospective students, and also could be helpful for attracting additional sponsored research funding. Next slide. Just to describe the new department, we have a world-renowned collegial faculty that have extensive experience working together. We actually enjoy working together. We have done so for years. We have 16 faculty members in the department, and these include 2 former chairs of the IHD. And also we have 2 faculty that have moved from another department. We also have a couple of faculty members that are joint faculty members with other departments. Extensive expertise that are really well known around the world. We have coherent academic programs, which I'll describe in a minute, that can really be flexible to cater to student-specific interests. We have expertise that span some of the most pressing problems of low and middle income countries that are the focus of the Sustainable Development Goals, including expertise in malaria, infectious disease, malnutrition, family planning, maternal and child health. A robust sponsored research portfolio, including funding from NIH, as well as a lot of funding from USAID, CDC, Gates Foundation, among other sponsors. And we've always had very strong linkages with international and local partners, including schools of public health in the Congo, in Rwanda, Vietnam, schools that were, Tulane was instrumental in helping to establish. And we also take advantage of a lot of Tulane's international health offices, including those in the Democratic Republic of the Congo, South Africa, and Peru. Next slide. Our mission is to improve the health and well-being of vulnerable populations around the world by eliminating health inequities and promoting human rights and social justice. It will not be just the same old department we had. It's really more focused on sustainable development issues, and that's something I'll talk about soon. And we hope to achieve our mission by being a global partner in a number of areas, capacity strengthening, research, service, and advocacy. There's a lot more to the mission statement than this, so I would encourage you to take a look at our website for the full wording of our mission statement. Next slide. In terms of our two academic programs, we have a master's program in IHSD, and we are going to be starting a new doctoral PhD program in international health and sustainable development, and that will start a year from now in fall of 2022. Next slide. Our master's program is led by Dr. Ava Silvestra, who is a clinical associate professor in the department. She's a graduate of Tulane's doctoral program and is also teaching in the undergrad program. And the program is designed to train the next generation of international health professionals combating major health problems facing vulnerable populations. And we really focus on three types of skills: on assessment of health and health systems problems, on designing and implementing programs and interventions tailored toward international health contexts in low-income countries and middle-income countries. And also our bread and butter is monitoring and evaluation. So we have a lot of coursework and applications in monitoring and evaluating those programs and interventions as applied to a lot of different substantive areas. And here we see a picture of Dr. Silvestra along with colleagues in Ethiopia. Next slide. Our course requirements is listed here. In addition to the foundational requirements, students take 11 program courses that are specified, as well as a content area which they can choose among, including family planning, M&E, as well as a lot of other areas, as well as a practical requirement and a integrated learning experience. And those are requirements of all master's MPH programs within the School of Public Health. Next slide. And we also have courses abroad. We do take advantage of the course that Gretchen mentioned in food security and resilience that's offered in Italy. Our department offers the public health program course in Cuba led by Dr. Arachu Castro, which is a very successful program that is done typically every summer. And we have some plans for new courses in other countries that we'll hopefully announce soon. Next slide. This is some examples of some of the first jobs that where we place some of our MPH graduates. And you can see that they're both located both internationally as well as in the United States. Some of the places where we place graduates include the University of North Carolina, but that's based in Malawi. Some of the international organizations that do work with USAID, such as APT Associates, located in Bethesda, Maryland. But this just gives a flavor of some of the first jobs. Sometimes they take domestically oriented jobs, and they're well equipped to take on those jobs. So, but most of them are more focused on international oriented jobs. Next slide. We also will be launching a separate PhD program next fall. It will be a highly specialized training program integrating theory and applied research in a focused substantive area of global importance. Graduates will have in-depth expertise necessary for a research career, either in academia, a global health organization, a research organization, All of this is mostly focused on goals of sustainable health systems, other aspects of sustainable development. And there'll be some common areas with the social behavioral science and PhD program, but there'll be some differences. And again, that will start in the fall of next year. Next slide. To give you an idea of the course requirements, beyond the MPH degree, there will be 30 credit hours that are required. We have a new course that is being set up to start next year on sustainable development theory and practice. We are really excited about that course and are getting ready to submit that to the curriculum committee this week. That will be one of the main differences with the social behavioral sciences program. But we have a lot of courses that are common with the program in social behavioral sciences, including social determinants of health 1 and 2, advanced research methods, qualitative methods. A lot of our students do mixed methods research, both for their dissertation and later on in their research careers. We have new courses at the school level in grant writing and pedagogy, and then we have electives where students can choose 3 courses or 9 credits, along with their, of course, comprehensive exams and their dissertation. Next slide. This is some examples of some jobs of some of our more recent PhD graduates over the past 3 to 5 years. We have, they can go into academia, including at the University of Washington, at the IHME group led by Chris Murray, assistant professor at Brigham Young, Temple, but also in other international health organizations such as WHO. We have one of my former students is at the Universal Health Coverage Advisor in Cairo. And again, this is just a flavor of some of the kinds of jobs that we prepare our PhD graduates for, and they've been highly successful. Next slide. In our research, and this is also true of our academic programs, we really focus on these focal areas. Our bread and butter, where we're really known around the world, is monitoring and evaluation. That is the focus of a lot of our sponsored research projects from USAID, also even from the Gates Foundation and other sponsors. We really have an excellent reputation in this area that we apply to a lot of different areas. But also more substantive areas we focus on, including family planning, infectious disease, complex emergencies, resilience, and food security, led by Dr. Nancy Mock. My area is health system strengthening, and also we'll be focusing on sustainable development and maternal and child health. Next slide. Our work and research, but also capacity building, because we do get a lot of sponsored research funding for different kinds of capacity building initiatives, really spans the globe. We're very involved in Africa, in the Democratic Republic of Congo, where I do a lot of work. We're focused not only on research, but also training folks at the schools of public health in various aspects of monitoring and evaluation capacity. And that's an example of some of our capacity building in that country. Also work in Asia, Latin America, where Dr. Arachu Castro does a lot of work. And to some extent, we're involved in the Middle East. And some of us do work in the United States as well. So it's not only international research. Next slide. So we do have some ideas about strengthening our academic programs, and we are in the process of doing an assessment of the job market for public health graduates. We want to make sure that we're training our students to be well positioned to get jobs that are in areas that are in high demand. And so far, we've identified a few areas where I think we could improve, including program management, more in terms of complex emergencies and resiliency, and also skills in analysis and use of data for monitoring and evaluation based on routine data from health information systems, but even non-routine data. I think we want to spend more emphasis, more time and priority on some of those areas. We want to further strengthen our coursework in sustainable development. I mentioned this new course in the doctoral program, but we have ideas for other courses at the MPH level that we will be hopefully announcing soon. The dean has some excellent ideas about developing partnerships with universities overseas. So that will be something that we work on. And one sort of untapped source of expertise that I think we can do better on is improving our relationships with alumni. We have a lot of international health and development folks on this call who have really played a strong role in establishing our legacy, and we want to improve our communications with alumni so that we can learn from you and we can tell you what we're doing, and just to that whole dialogue between us and alumni, I think will be really a great asset to the new department. So I'll end it there. And just the next slide, I did want to mention that if you do want to find out more, take a look at our website, and here's some contact information if you want to get in touch with us. That's also on the website. So I'll turn it over to Dean LaVeist for the Q&A.
So let me, I neglected to mention in my opening remarks that if you have any questions or comments, please do add them to the chat. I'll read those questions and we'll get you an answer to those questions. We do have a couple of questions. I'd like to start and with some questions that we received earlier today. The first question we have is, why are we creating a new department of international health after merging the past international health department with health systems management a couple of years ago? So maybe I'll take this one and I'll turn over the other questions to the panelists. Why are we doing this? We're doing this for several reasons. I wasn't here in 2011 and can't really speak to what the conditions were that my predecessor faced that led to the decisions that he made. I can only speak to where we stand now. Looking at where we are now and the legacy of our school as having a huge international footprint, we thought it was important to shore up that legacy, to ensure that our alumnus had a home back here at the school so we can maintain an ongoing relationship, that we can have a focus on the international health work that we've done. We've been a leader in global health for many years at this university, and I think elevating the global health work to the level of a department was important. Also, the social sciences, I think, was buried along with international health in the previous configuration of the departments. So the Department of Global Community Health and Behavioral Sciences was not adequately promoting the social sciences, nor was it adequately promoting international health. It was a very large department, unwieldy, about double the size of the next largest department, I think. So there's a number of reasons why I think it was important for us to separate into two different departments so that we can have sufficient focus on both the social, behavioral, and population health sciences and the global health work that we do. I would make another comment I'd make about it is that, early on when I joined the school, my career has been mostly in domestic health based in the United States. And I know that there were some who felt that the school was going to pivot away from global health. And I want to be absolutely clear in saying that a first-tier school of public health does not do only one thing. It doesn't just do what the dean does. That, if we're going to be a first-tier comprehensive school of public health, we have to have both a global and a domestic mission. We have to be strong in the social sciences, the behavioral sciences. We have to be strong in the natural sciences, the life sciences. A great school of public health is not good at only one thing, and it's essential that we have sufficient focus on all of the various aspects of public health. That's why we're making this change. The next question is, what impact, if any, will this new structure have on current undergraduate students who are majoring in public health in the BSPH program? Also, will the dual degree MD, MPH still be available in the future? And I'll turn this one over to the panelists to give them an opportunity to respond. So first, what impact do you perceive this change having on the BSPH? And I will, as I see the other panelists are still joining us, I'll wait until I see their cameras turned off before asking them a question. I'll turn this one to David.
Well, thank you. Well, the new structure in terms of these two new departments won't affect current BSPH students other than having two more specialized departments that they can choose from if they decide to do an MPH. We do in International Health and Development have a number of faculty that teach in the BSPH program, and that gives some of the undergraduate students more exposure to our faculty in terms of the international research that we do. And we also are going to try to identify students interested in international health earlier on in the BSPH program and invite them to participate in our department events. And those students who go on to do an MPH at Tulane or other places, they're extremely strong students. We've been successful in attracting some of them to our MPH programs, but I think we want to even attract more than we do right now. So that's what I would say from the international health side.
Okay, Gretchen, anything you want to add?
Yeah, I think that David mentions that, we want to build our relationships with BSPH students. We do have a number of faculty that teach as well in that program, and we are trying to help them identify programs and opportunities within our department that would best suit their needs. So we're working very closely with BSPH students. I did want to add too about the MD MPH student. I did mention it in the presentation. We are keeping that program. It's a very robust program, and we're intending to maintain that within our department.
Will the PhD be offered for either of these two departments? I think that's a pretty straightforward. Let me just take this one so we can move on. Absolutely. The existing PhD program in GCHB has moved into the Department of Social, Behavioral, and Population Sciences. The Department of International Health and Sustainable Development is building out the curriculum now for a new PhD program that will be stood up, and with the intention of having the first cohort of students enter in fall of 22. So yes, each department will have its own PhD program. We have another question here. One of my favorite parts of the Tulane experience was Peace Corps service as part of my MPH in International Health. Is that one of the partnerships mentioned? And I guess this would be a David question.
Well, actually, this might be a good time to bring in Mark Van Landingham. I think he's probably in a good position to answer this question because he's been very involved with former Peace Corps students.
Yeah, I'm happy to do that. Many of our faculty are returned Peace Corps volunteers, myself included, and we draw heavily on returned Peace Corps volunteers for students coming into this school. And one of my favorite programs too was the joint Peace Corps IHD experience, and it was great for faculty because then we had a 4-year relationship with our students rather than a 2-year relationship. I was very sad to see it go. It was Peace Corps Washington's decision, not ours. I would have continued it indefinitely, but we still have really strong relations with the local Peace Corps recruiter, with Peace Corps Washington. We're having lots of discussions about, I'd love to see some kind of new iteration of that moving forward. Peace Corps Response has been really popular among a lot of our students, and we're still recruiting a lot of returned Peace Corps volunteers into the program.
So Mark, I'll ask you this follow-up to that question, which is, and will the sustainable development coursework include environmental aspects?
Yes, we have several people, who are very strong in environmental aspects. Laura Murphy, for one, is an internationally known scholar in this area. She gives several lectures, for us. She's she at least has taught a course in that area. Catherine Antonopoulos and I spent a lot of time on that topic in our overview course that all the students take when they first come into the program. The short answer is yes.
I would also add that we are currently in the process of searching for a new chair of the Department of International Health. We're looking for a chair. So if anyone on this call is interested or knows other people who you think would be appropriate for it, please do send those names along. But one of the topic areas that we are looking to refocus that department around is the issue of climate change and its impact on health. We've developed some new coursework in that already, but we're looking to really make that a central feature of what we do at the school. So, and of course, that will be, those courses will be a resource for the entire school, not just the one department.
Thomas, sort of jump in. It's actually the chair of SBPS that we're recruiting, but everything else that you said is absolutely.
No, we're recruiting a chair for environmental health as well.
Oh, you said environmental health. I'm sorry.
We're doing a church for, and so we will be, I think, dramatically increasing and improving our programming in environmental health sciences, and I think that will impact all of our departments.
Can I
Okay.
add something? I
Please
just wanted
do.
to add something about the Peace Corps volunteers. This past year, the fall of 2020, we saw a really strong group of returned Peace Corps volunteers join our program. And part of it is we were benefiting, fortunately, from the COVID pandemic because they were all evacuated and had to leave. And there were different initiatives that were, started at the school to recruit them. And I think that all of us who have interacted with them or who have had them in our classes can really speak very strongly about this connection. And I currently have one student who was a returned Peace Corps volunteer from Guyana who was able to return this summer to do her applied public health experience, her practicum in Guyana. So we continue to definitely have very strong connections with Peace Corps.
Okay, next question. Is there a concerted effort to recruit international professionals for MPH and PhD degree programs with international tuition support to further illustrate a focus on capacity building strengthening? Anyone want to volunteer to answer that one? Okay, then I'm going to volunteer David as chair to answer that one.
Yeah, at the doctoral level, we are putting a lot more emphasis on doctoral funding, and the dean, this is one of the dean's priority areas where we're trying to mobilize additional funding from the university to support PhD programs and not have self-funded students. And we would very much like to target international health professionals for that program. At the master's program, that's something where funding is much more limited. There is some, but not a lot of funding, but that's something that's an area where we can look for. There's a lot more constraints in terms of what donor support in that area than used to be the case when I joined Tulane in the 1990s, but that's something that we can explore.
Okay, the next question is, Dr. Clum is an interim director. Is there a search in progress? So she is interim chair of the department. We do have an active search that is ongoing, and actually Dr. Van Landingham is chair of that search committee. And so hopefully we'll be able to announce the new department chair in the coming months. Next, okay. Should we consider the 1 becomes 2 a failure of the earlier experiment of 2 becomes 1? So I interpret that to be asking, is this an acknowledgement that the changes, that the realignment that was made in 2011 was failed? And I think I addressed that in my opening remarks, that I'm not in a position, I don't think, to really comment on the conditions that my predecessor was facing in 2011, and I can only really speak to the conditions today. And I think that the conditions today warrant the change that we're making. And I think this will be a change for the better. Next question is that you mentioned the research and capacity building activities span the globe. Would you please explain more about those centers? Shall students go to those centers, or is it only after graduation?
Well, we have a number of Tulane offices overseas. It's really designed to facilitate our sponsored research programs in those countries. For example, in the Democratic Republic of Congo in Kinshasa, we probably have an office of over 50 staff. The way that students take advantage of it is that we are able to use students as research assistants, and they do have opportunities sometimes to go overseas, especially doctoral students, but sometimes MPH students as well. But there are some other kinds of partnerships where we hope to develop with other schools of public health in different countries around the world that are not yet established, where we hope that some of our students can take courses in those schools, and on the other hand, students in those programs overseas can come to Tulane and take advantage of coursework in New Orleans. But those are some ideas that are things that we've been talking about within the school.
Okay. How will this reorg help us compete with our peer schools of public health? I'll throw this one open to anyone who would like to comment, although I'm looking at Kat because she hasn't said anything yet.
Sure. Hi, everyone. Yeah, I do think in both ways, but I can speak to the Department of Social Behavior and Population Sciences. I think, we have a lot of health challenges that are very complex, and the new name and new department and the focus to really include population science, which is an emerging science focused on multifactorial conditions that shape health, including those exposures that are hard to tackle, things like racism, violence. And I think, having social and population science at the forefront is key. So I think it positions us very well compared to other schools. And then I think, from the behavioral science perspective, really couching behavior in context and the way we're thinking about this new department will really strengthen us moving forward. So I think from that department, we're in a good place.
I think I would like to just add that, that we live in a rapidly changing world. Things change all the time, and we have to be adaptive and we have to change. And, and so I think, like, yes, it does seem very clunky that there was, changes and we're changing again, but we're adapting to needs and to different contexts that are in place now. And I think that this, for international health and sustainable development, this really kind of allows us to really look a little deeper into the way that we are educating future public health professionals in an era where we're paying more attention to topics of anti-colonialism, anti-racism in our work, and looking a lot deeper. And we know, and our students are demanding that. Like, this is another area where we have to change, and having separate departments really kind of allows us to really make these changes that are needed so that we can keep up and maybe even get ahead of where we're going in terms of addressing global public health problems.
Very much agree. Anyone else want to comment? No. So will the new administration be more favorable for partnerships recruitment? Will the new administration be more favorable for partnership recruitment? I'm a little stumped by the question because I'm not sure what new administration this is referring to. Oh, Biden administration for Peace Corps. I don't know that I'm the best person to answer that question. Anyone want to take that one?
I'll keep the ball on the Peace Corps initiatives. I hope so. I think so. There seems to be a lot of energy in the program. We don't know exactly what they're going to do next, but like I said earlier, we're in close contact with them. We've expressed a lot of enthusiasm. They really like Tulane. Peace Corps of Washington does, because we've been such a strong partner with them. So fingers crossed on that.
Yeah.
Yeah, I would just add that with the new USAID administrator, they're very much adapting to the changing world, the COVID pandemic, and are very much focused on vaccine delivery. And we've really taken advantage of the opportunity that's presented by COVID. A number of us are doing research on COVID. I am doing some things with UNICEF. I know Dr. Castro was one of the experts that was called to Capitol Hill to testify about the COVID response in Latin America. So I think we can mobilize some of our expertise to really adapt to some of the new changing priorities of the Biden administration. I think we're in a good position to do that.
Okay. Peace Corps Biden. Well, it seems like we are starting to slow down with questions. I would just say, I think that this is really a monumental shift for the school. I think this is going to be great, both for the social and behavioral and population sciences, and also for the international health. I think it will help with recruitment, with students being able to find the various programs that we have. And also for it to message to everyone that the seriousness with which we take global health as well as social sciences, and that we're treating both of these important areas of public health work at the level that is appropriate, I think. So since we're not getting any other questions, I'd like to turn it over to the panelists to see if you have any additional comments. Oh, I'm sorry, another question just came in, which we will take, because I think this is a good question. And this is a question asking about practicums. Will you be seeking additional organized international practicums? I will, David, you have a question, answer? I have something to add too, but let's start with.
Okay, I was just going to mention that we are going to try to do a better job in trying to place students, especially by having relationships with different organizations that we work with. We have a new director of MPH programs at the school level, Lena Moses, and she's in the process of looking at our practicum program and how we can do a better job to establish relationships and provide more support to helping students find practicum opportunities. So that includes opportunities domestically, but it certainly includes opportunities internationally as well. So that's what I have to say about that.
Yeah. Ava, you had something?
No, it was something similar, that we definitely want to make kind of more formal partnerships between Tulane and other institutions to make it easier for our students to find practicums. We have one right now that started this summer with the International Red Cross Latin America division, that through a colleague of ours who knows someone who works there, they reached out to us to try to set up a more formal partnership, and we were able to place 2 students this year working with the International Red Cross Latin America division. So that's just one example, and they want to continue this relationship with us, and so it'll be one opportunity for students to be able to take advantage of this. Of course, this year I should also say a lot of our practicums were virtual, as we're having a virtual webinar now. And that again just shows how we had to adapt, and we found a way to get around it, right? We adapted our teaching to hybrid and online. And then we were also able to adapt some of the requirements for our students so that they could continue and graduate on time from our program.
Yeah, I would also add to that, because I think this is extremely important, that, as I'm sure the alums know, we generally relied on students to find their own practicums. That is definitely something that we are changing. Not only have I appointed Lena Moses to be director of the MPH program, and she's taken this on, we've also appointed a new director of career services, and we are currently searching for an associate dean for public health practice. And the 3 of them will create a team that will focus on identifying practicum sites and helping students to get placed, so that the emphasis will be on the school helping the student to find the practicum and not the other way around. So we are definitely formalizing the practicum process, and I think we'll be doing a lot better with that going forward. So I just want to comment on a comment that just came in, and the comment is that our real legacy is that we are the oldest school of public health in the nation, and that should be continually emphasized to future students. I'd say one slight correction. We're not actually the oldest school of public health. We're the first school of public health, founded in 1912. There was a long period of time when the school was folded back into the School of Medicine. So we have not been around since 1912. So the way I always talk about it is that we were the first school of public health established in the United States, not actually the oldest. That's just for that's a family message. That's for us internally here, that we are the first. And I think the question or the commenter, I think makes a really important point, that throughout my career, as many of you know, I spent most of my career at Johns Hopkins, and I was under the mistaken impression, as is I think everyone at Johns Hopkins, that Johns Hopkins was the first school of public health in the United States. They are in fact the 3rd school of public health in the United States, not even 2nd. And I think it's a shame that I could have worked as a professional in public health for so many decades and not know that Tulane was actually the first school of public health established in the United States. So I absolutely agree that we should, being the first school of public health is not the most important thing, but it is a thing, and it's our thing, and it's not Johns Hopkins's thing. So we absolutely should make sure that everyone knows that we were the first school of public health. And to repeat a portion of a conversation I had with the Harvard's dean, 1912 comes before 1913, which is when they were founded. So this is simple math, and it comes before 1916, which is when Johns Hopkins was founded. So we are absolutely the first school of public health, and we should make sure that that is known to everyone in the field. I'll throw it open for any last comments or remarks from any of the panelists. Come on, Ava, I know you got a comment.
You know, I have a child running around here. I'm trying to pause and mute strategically right now. No, I think that this is incredibly exciting. And I think that what I also wanted to say that because we had the opportunity to be together with colleagues like Dr. Clum and Dr. Theo, we've really have built, I think, really strong relationships. So just because we're going to be in separate departments doesn't mean that we're not going to interact with one another. We're not going to collaborate with one another. Those avenues are still there. And I think that's important because then while we have two separate departments, there's still departments that are like a big family, right? And I think that that's an important piece to remember moving forward.
Okay.
Absolutely agree. Thank you.
Anybody else?
Yeah, I'd like to key off something Eva said earlier in the discussion where she said that, change is good, or at least it's inevitable. I mean, things are changing. We have to change with them. And a lot of things that the school is doing now just weren't possible, in the past, or at least not to do it well. But the recruitment of Dean LaVeist, who's a world-renowned social scientist, makes possible, a lot of investment in this new social science department, and the fact that David Hotchkiss, is at a point in his career where he's willing and able to kind of take on the challenge of reinvigorating IHD is also something that I think that the dean was really smart to take advantage of and leverage for us. So thanks, Eva, for pointing that out.
Yeah, and thank you, Mark, for saying that. So for those of you that will be attending the American Public Health Association meetings in October, and I hope that many of you will be there, we intend to have a very large presence there at the conference. We will have an alumni reception on the evening of October 25th in Denver. We're planning for that. We will have an exhibit booth. Please do come, please. And we'll also be sure that we'll have a posting of all of the Tulane affiliates that are making presentations, faculty and students, so that you can attend presentations and hear the work that's being done. Hopefully you will come to the reception and make yourself known and reconnect with the school and remain a part of the school, of this community. Thank you all. And I hope to see you all in October at APHA.
Thank you.